Welcome to the Lion's Den, a place you'll find just men talking. Today I have an honored guest with me, Dr. Raben, Dr. Adam Raben from Christiana Care. Dr. Raben, could you introduce yourself?
Yeah, I'm Dr. Adam Raben. I'm a radiation oncologist and chairman of radiation oncology at the Helen F. Graham Cancer Center on the campus of Christiana Care in Newark, Delaware.
Doctor, can you briefly explain the science behind radiology?
Yeah, so radiation therapy was really invented, 60, 70 years ago with the understanding that radioactivity could actually treat cancers that were growing. A lot of it started with Hodgkin's disease back in the 40s and 50s, and then it expanded to lung cancers and different head and neck cancers. And it found that in using radiation therapy in different ways, you could actually attack and treat tumors.
Good. And how's radiology evolved? How does it look in the future?
Yeah, so it's interesting. If you look at the landscape of oncology and medicine in general, you won't find a field that has advanced more in terms of technology, understanding of biology and immunology more than radiation oncology. The advancements in technology that allow us to deliver more precise radiation that then allows us to incorporate other treatments with the radiation and then allows us to treat in shorter amounts of time that make it more convenient and easier for patients and less expensive have really come into the forefront in the last decade. The radiation techniques that we can use are now even associated with robotic treatments such as CyberKnife, which is a robotic radiation machine that can move in multiple degrees of freedom while you're laying on a table. And so these new treatments have allowed us to move away from some surgical procedures where the radiation is just as effective because it can be given almost like an ablative dose rather than what we call a fractionated dose. So we can give it in super high, short quantities that can actually cure tumors probably as good, if not better, than what we were doing before.
Oh, that's great. That's good on the horizon. In my case, you installed gold pellets into my body. I know it was to target the area, but can you elaborate on what?
Yeah, so obviously one of the things that's so important for us is precision, and because tumors and organs are surrounded by other normal organs and structures, it's very important that you want to treat the area that you want to treat, but exclude the areas you don't want to treat because it could cause side effects. In your case, the bladder is right there, the rectum, the penile bulb, the urethra, the hips, so a lot of critical structures in a very tight area. So ways of improving precision are what we call image guidance, where we can use tools such as fiducial markers that were implanted in you that are not foreign bodies in the sense that they would cause a reaction, but they can be relocated every single day before treatment to know that we're aiming precisely at the exact same area that we want to treat every single day, which obviously then minimizes side effects.
So you said the implants move?
So the implants don't move, but the organs around them do. And so if you don't have a prostate and the bladder and the rectum on either side, when you have filling of the bladder or filling of the rectum, it can move those gold markers. So if you didn't know on a daily basis that you had that kind of changes in your organ structure or where they're located, you might miss the area that you were trying to treat. So.
Also, as part of the clinical trial, I was given higher doses with less visits, which did it end up being the same amount of radiation, or did I get less radiation?
You actually, in some respects, got more radiation, and so this was a clinical trial to see if we could increase the daily dose and shorten the overall course of treatment and yet still get the same outcomes. And the outcomes are divided into two parts. Number one is curing the cancer. Number two is preventing more side effects than what you were normally doing before. And so if you can hit on both, that's a win-win. Now, you could argue that maybe it's a better cure rate, but more side effects. And are you willing to live with that or the risk of it?
Right.
On the other hand, if it's not going to improve outcome and going to cause more side effects, then you wouldn't want to do it.
Right.
So far, the study that you participated in has shown what we call equipoise with the standard of care, so that this has been shown to be a safe model for treating men who have had their prostate removed that need radiation therapy, but can be done quicker and precisely and still have the same outcomes with the same amount of side effects.
Gotcha. Okay, but in my case, in my view, it was the desired outcome.
Yes.
Because as I told you earlier, I just recently had blood work done, and my numbers are undetectable, which is really great. Which is a win.
Yes.
I still thank you guys for it.
Sure.
Yeah. As a result, will the process now be the norm, or is it still sort of just something that you?
Well, it's evolving. There are clinical trials that are ongoing to continue to find ways of making treatment faster and more convenient, but still offering the same safety profile. There are studies now incorporating newer medicines that we didn't have before when you first started, that we call next generation anti-hormone therapy that we're incorporating with high-risk prostate cancer. And then finally, we're really incorporating a whole new world of what's called personalized genomics. We're able to look at tumors in a molecular way to give us some basic understanding on a molecular level the risk of the cancer spreading, and do we need to be more aggressive or less aggressive?
Yeah.
There have been several studies recently showing that if you have low-risk genomics, you may not need hormonal therapy. If you have high-risk genomics, you probably should get hormonal therapy because it will have an impact on you. So the biggest areas in our field that are changing as it pertains to you is the incorporation of genomic information after surgery to give us some guidance, and the utilization of newer medicines that we can maybe not extend the duration of the hormonal therapy, but we can intensify it and shorten the course of it for men.
And one thing I didn't understand is that I got my prostate removed, and I'm still told that I can still get prostate cancer.
Yeah, because if you think of it, if you look at the prostate, and it has a capsule, but at the end of the capsule is where you urinate out of. And it's in that area where if you think of a dandelion, where you pick up a dandelion and blow on it and it kind of seeds out, cancer cells can shed just in the same way. And they may have shed down where they reconnected things, and so they sit there for a while. They don't have a blood supply. And then all of a sudden they figure out ways of getting a blood supply, and then they're able to grow.
Gotcha.
Yeah.
Now testosterone, sort of, is it a problem, or could it cause the prostate cancer to?
Well, that's a great question, and that's an area of investigation and interest, because if you're out for, let's say, 4 or 5 years and your PSA is undetectable, then the issue is, if you're low testosterone, is it reasonable to give you testosterone replacement? And I think the answer is yes. I don't think that's going to cause your cancer to grow back. Either your cancer is gone or it's not. And either way, you're going to know. So I think it benefits some men to go on testosterone replacement after a certain point of time. And I think you're an example of someone that may have hit that mark. And so I think for general health, some testosterone replacement is reasonable, and I think that's sort of where some interest and curiosity is. And so we want men to recover their testosterone. Another reason we're looking at newer agents that have a faster recovery time, what I call a faster off-ramp. And so there's a new generation medicine called Relugolix that provides men an alternative to the injection that can last a lot longer for men.
I got you.
So.
Okay. Thank you, Dr. Raben, for sitting with me today in the den. I really appreciate you. Men, we have to be a champion for our health, holistically, mind, body, and soul. This is Men's Health Month. Take the time to check in both physically and mentally, and take time for yourself to get in touch with your soul, your inner self, the inner you. If you haven't yet, schedule an appointment and start your journey to great health. I'm telling you, good health improves so many other areas of your life. You'll be much happier, and she will too. If you don't take time for your wellness, you will be forced to make time for your illness. I'm going to say that again. If you don't take time for your wellness, you'll be forced to make time for your illness. Let that marinate. This is a glorious day. Take a moment to breathe. I'm Ranard. Peace.
That's awesome. That's a great saying. Did you come up with that? That's really good.
No.
I love it. That's something I'm going to start stealing from you.